There are 40,000 adults in San Diego's mental health system. Recently, the County Board of Supervisors asked for a review of current programs for the severely mentally ill to compare to the state's Laura's Law, which San Diego could choose to participate in. Here with further details on the report are Alfredo Aguirre, Mental Health Director for San Diego County, and Teresa Bish, formerly with the San Diego County Mental Health Board. Welcome.
Thank you.
Alfredo, your team had 90 days to complete this report. What sort of benchmarks were you used to look at the current system of care and how it works and compared to other options like Laura's Law?
Certainly. Yeah, some of the benchmarks we used was to really look at our current system, what services are available for people who are not accepting or not responsive to care or resistant to care, as well as looking at Laura's Law, understanding exactly what it is, the criteria, and how potentially it would work in San Diego. Also, we looked at pending legislation. We looked at cost of doing Laura's Law, how much would it cost. We looked at our current cost of providing services with similar programs that we operate here in San Diego. And then ultimately, we wanted to look at how could we strengthen our continuum, what pieces needed improvement.
If you could, in a sentence, just for people who don't know, the major difference between Laura's Law and what the county uses is what?
Laura's Law provides an outpatient commitment order, an order from the judge to receive outpatient services for people who have been resistant to care. And that's different from our current system, which is basically voluntary, and it includes an outreach program called the In-Home Outreach Team.
Yeah, In-Home Outreach, or IHOT. Teresa, I understand your brother suffered with severe mental illness. Tell us a little bit about him and how that prompted you to get involved in working with the board.
Sure. My brother Vincent was diagnosed with schizophrenia in 1981, and he was one of those severely mentally ill, diagnosed with schizophrenia, that was in denial of his condition. So as a consequence, he would cycle in and out of jails and hospitals. He was a high utilizer of the most expensive county services. And he had a medical condition that didn't allow him to recognize his schizophrenic needs there, and need for treatment, I should say. So consequently, I became a volunteer in our mental health community. I was appointed to the Mental Health Board in '07 as a family member representative, and was chair in 2010 and 11, and did an in-depth look as a consequence of the services for the severely mentally ill and the funding that was going to them.
That you directly participated in with him. You helped him. We're gonna come back, but I want to ask Alfredo about this report a little bit first. You presented the report last night to the Mental Health Board meeting. You were there as well. What was Health and Human Services recommendation from this report to the Board of Supervisors?
The three recommendations in the board action was, number one, is to accept the report that was completed. Secondly, to increase our in-home outreach team from 3 pilot regions, North Coastal, East, and Central, to the rest of the county. And thirdly, is to move towards the implementation of Laura's Law, pending the identification of revenues to provide the services, as well as looking at legislative remedies to make it a stronger law.
And Teresa, you were at that meeting along with a lot of other family members who had people who were mentally ill in their family. A lot of people were advocating to the switch to Laura's Law rather than expanding what we have, including Michael Plopper. He's the Chief Medical Officer at Sharp Behavioral Health Services. I want to listen to what he had to say.
Sure.
One of the requests by the Board of Supervisors was to look at all the other types of costs which might be saved associated with utilizing Laura's Law. And I don't hear that. I didn't see that here in terms of reduced incarcerations, in terms of reduced hospitalizations, in terms of reduced police contacts, et cetera, et cetera. So there are many different associated savings which aren't referenced here.
So, Alfredo, we'll start with you on this one. Did the report look at the cost? How would you respond?
Part of the report, the work that was done in the report, we certainly looked at. We compared outcomes of, for example, Nevada County's program, which is a very small county up in the foothills of California. And we also looked at the outcomes of our full service partnership, which are very similar to the program in Nevada. It just doesn't have a court order. And then we also looked at some of the outcome information after 1 year of implementing the in-home outreach team, which is not a treatment program. So we actually did compare outcomes. Specifically, the board did not request as the formal part of the report to have a comparison of evaluation outcomes. However, it was part of our study.
I know, Teresa, you wanted to respond to that. Yes.
Just to try to clarify for your listeners, Laura's Law is a legal framework that utilizes civil law versus other more involuntary means that are highly costly, expensive. They are very restrictive of civil rights. And so with Laura's Law, then, the directive is for assisted outpatient treatment utilizing existing programs, whereas IHOT, as Alfredo said, isn't meant to be a long-term solution. It's referring people, and in the report, it's referring them to the majority of people, to the more costly services, jail, hospital, PERT, etc., utilizing 5150. And the report is incomplete, as Dr. Plopper pointed out.
Right, and I have to cut you off there because we're almost out of time. I just wanted to say, Alfredo, one last question for you is, what would have to happen to switch from the program that we have now to Laura's Law?
Well, first of all, we'd have to identify the appropriate revenues, and we have to see stronger enforcement, a change in the law to build some more teeth to people that, even with a court order, are still resisting care.
Okay, there's a lot more on our website, and I'm so sorry we're out of time. Okay. So thank you both for go
just
ahead.
Real quickly, I don't believe this is an either-or situation. IHOT can exist, and Laura's Law can exist as a complement to that, and vice versa. So I think that we need to look at all remedies without saying that one program versus a legal structure is the answer.
Okay, right. Well, thank you both so much.
Thanks,
and as I said, a whole lot more on our website.
You're welcome.
Okay.
Good to be.
Bye-bye.